Hi, Dr. Brian Kaufman, a retired family doctor, CLL patient, co-founder, executive vice president of the CLL Society. Lorna?
I am Lorna Warwick, and I'm the CEO of the Lymphoma Coalition, which is a global network of patient organizations that support those who've been affected by lymphomas, which of course for us includes CLL.
Right. So as we both know, CLL has the blessings of being both a leukemia and a lymphoma. So we benefit from research in both areas. And you've done some really important research looking at the communications that happen in the healthcare provider's office with patients. And one of the factors that you found that was important in determining how well that communication worked was the age of the patient. Can you tell us a little bit about this research? You presented this at ASH, so it was quite a big survey. So set it up for a little bit. Tell us, the audience that you presented this to, and why you planned this research, and what your findings were.
Of course. So every 2 years, the Lymphoma Coalition does a global patient survey. And this particular study was looking at the results of the 2020 Global Patient Survey, where we had almost 12,000 respondents globally. So it's quite a good data set. And one of the things that intrigues us when we're looking at patient information levels, which previous work of ours has shown that those that are well informed have better overall patient experiences and report better outcomes. And so when we're looking further into those issues regarding patient information, we decided that maybe it would be interesting to look at this work by age levels. And what we did is we broke up the global patient survey data by different age ranges and did a comparison about how well patients feel about the communication they're having with their doctors and the information that they are receiving about their particular diagnosis and their care. And what we found is really overall older people, so 70 plus, actually report fewer issues with communication than younger people. And there's some different ideas about why this might be happening. But for us, when we're looking at it from a patient perspective, it's perhaps a reminder to our doctors that for those that are younger than the 70 plus, they should probably look at giving them more information or checking with those patients and making sure that they are understanding the information that they are providing, since that group seems to struggle the most. Overall, though, even those that are older are still reporting some difficulties. And really, the number one thing that everybody is looking for is more information on treatment options. So again, a reminder for our healthcare professionals as they're working with our patients that this is an area where they could fill in more information, give people more options, or explain to them if there aren't a lot of options, why that is, so that people feel more informed and can make some better decisions for themselves and their own care.
And I think it's important to point out that you presented this research at the American Society of Hematology, which is the largest annual meeting of the very hematologists that you're trying to get this word across to, that this isn't just research for, to understand. This is research to educate the professional community about how they could improve their care of their patients.
Yeah, correct. It seems to us the perfect audience to try and get this message across. Hopefully, we'll continue with this messaging. We do have some supplementary report that is more in depth about this kind of information and how the communication could be improved. So we'll continue to distribute those with the audience, as well as pointing out things like what we discussed in our abstract, so they know there is good research behind this and therefore provides a good avenue for action moving forward.
Well, as you know, the CLL Society's motto is smart patients get smart care. And the way we get smart is learning from our healthcare providers. So that communication channel and checking into making sure that we understand is so critical. Any final thoughts on this important research?
Just that you and I, as you know, agree completely in that the informed patient actually has a better overall experience. So encouraging patients, if you're not understanding what your doctor is saying to you, to actually ask them to further explain more. And if you need to, find some other good sources of information. The CLL Society, if you have CLL, has some fabulous resources. So reach out and make sure that you understand your care as well as you can.
Lorna, thanks so much for what you're doing and what the Lymphoma Coalition is doing. It's such important work. Thank you.
Thank you, Brian.